This year is unique. This year is a milestone. It is 10 years we've been doing this. We've reached deep into our community, and it's the successes made possible by all that got involved in this.
I became aware of the African Association of Rhode Island, I want to say 10 or 12 years ago. Julius will know exactly. When I was working at Rhode Island Hospital. And Julius made me aware of a conference that was happening at Rhode Island Hospital about malaria, and particularly malaria in Liberia. And in the process, he taught me a lot about the African community in Rhode Island. And we've known each other since. What I don't think I was totally aware of was how many of the people I took care of, how many of my patients were from the African community. And as time went by, because Julius helped me understand about the size and the dynamics of the community, I began to be able to talk to the people I took care of and talk to them better about their own experiences and the things they needed and the things they wanted.
The African Alliance helps bring visibility to the organization and to the populations of Africans in Rhode Island, numbering approximately 10,000 people, but spread across the state. I think it can be easy for decision makers and policy makers and agency leadership to not notice and not give a lot of special attention to African health. And I think the African Alliance has helped to keep a focus on the health of Africans, help bring leadership together. For instance, I know that the director of the health department has been involved in the health summit since the beginning, either as a presenter or as a keynote speaker, and even as just a participant. And now with the new director of the health department, Nicole Alexander Scott, she too has been involved for years before becoming the director of the health department, and I'm sure will continue to be involved. So the African Alliance has helped to bring leadership and attention to these issues.
Special memories that I've had, especially for the summits that I've participated, is being able to talk on a health topic, and then at the end of the topic, have people come up with questions that they've had on their minds for sometimes 5 to 10 years, and then they see that this is really the opportunity to get it addressed face to face by a health professional who also happens to be from the continent. And I've had that experience in most of the summits that I was able to participate in.
I really like the fact that we have a summit dedicated to the health of Africans in the state of Rhode Island. I like the fact that we have a cross-section of Africans gathering together, talking about various health issues, various health topics, and really coming together as a community, focus on our health, which we understand to be as one of the most important things. And if you don't have your health, it's one of the wealthiest things that you have. And so I really like the fact that we can get together and discuss some of these issues and get together as a community.
Everywhere you have issues, women issues, men's problem for kids, these are ongoing problem that comes up. Community health, just making sure that we stay healthy, which is very important in life. So that's what I think is the impact that African Health Summits really focus on. Our health is our wealth, so we have to take care of it.
Sometimes our own health issues are not brought to the forefront. So diabetes, obesity, healthcare, the disparities in childbirth, those are things that our community needs to be educated on. And with that knowledge, we see that more of our Africans take more of a proactive approach to their health.
While I was at Lifespan, the healthcare position, I saw that when I got there, and I was there for 10 years, prior to me getting there in 2003, I noticed that Lifespan had been funding some community projects with the African Alliance, and when I saw that, I made sure that that funding continued. So every year when they would hold their health conference or any other community program, I always try to make sure that corporate America, at least the corporation I worked for, was involved.
When people come into the U.S., our health system can be somewhat daunting. It's different, doesn't really address in the same way that health systems do in other places people's concerns and sort of gaps in understanding of their bodies and what health is and where it comes from. So for me, the opportunity at least once a year to offer people a chance to come in and get that information, to get their questions answered, to seek support for problem solving in their own families and their own communities, it made a tremendous amount of sense to me.
The summit gives an opportunity for people who might be less familiar with our approach to healthcare to come familiarize themselves in a less threatening way. And I think there's a lot we do in terms of primary care and prevention, which can really help a community at large, but can only help a community if people take advantage of it.
I think it's an excellent opportunity to engage with our African community, to listen to what their needs are, and to try to, from that listening activity, engage and respond to it. But it's also an opportunity to educate, to inform, and to empower our community. So I think it's a great event.
I want to take this opportunity to say thank you to everyone, everyone who have given up of his time, his treasures, his possessions, volunteer a day to meet with our community, to talk about and share with us reasons why we need to pay attention to our health. I also must thank everyone that have come to attend this event, where they have benefited from listening to health-related issues and the messages that come with that. My thanks to everybody.